Rosalie.
Great, Steve, and welcome to everyone joining us today. It's great to be able to chat with all of you about some of the stuff that Rosalie and I have done, and hopefully some reflections from Trisha once we get there. So I'm just going to join in for a few slides just to give you a sense of what AgeWell is all about. And then Rosalie is going to take over to talk to you about the top 10 insights from our project that we've been co-leading over the last several years together. So just going to go down to, okay, so for introducing AgeWell, so AgeWell is Canada's technology and aging network. It's a national center for excellence. And the vision is focusing on Canada's leadership in technology and aging that benefits the world, which is pretty broad. But the mission of AgeWell is to develop a community of researchers and older adults, caregivers, partners, and future leaders that accelerate the delivery of technology-based solutions and make a meaningful difference in the lives of Canadians. And so Rosalie and I have been leading one set of projects within a work package that's focused on ethics and policy. And that's what we're going to be talking to you about today. So when we look at AgeWell across the country, this is a slide that they've hopefully shared with us just to give us a sense of what they're up to at a very high level. So they've engaged 500 highly qualified personnel across the country in this mission towards supporting the use of technology. They engaged 250 partners as well as 200 researchers, 4,700 older adults and caregivers, and working across 37 member universities and research centers across Canada. So it's a very large network and lots of great work happening as well. And it's been an exciting collaboration to be a part of. So for our particular project that Rosalie and I have been leading, is focused on enhancing equitable access to assistive technologies in Canada. So this notion that it's great to develop lots of new technologies and be innovative and do all sorts of new and great stuff, but we also need to think about how we get those technologies to the people who need them in a fair and equitable way. And that's been the focus of our work. So I'll just go over this slide and then hand it over to Rosalie to go through our top 10 insights. But our overall project goals have been to examine how assistive technologies are accessed by Canadians and to identify funding and service gaps and to explore ethical issues on the equity of access to AT. So Rosalie will give an overview of the very specific projects we've done related to that. And then also to work with citizens, assistive technology users, policymakers, and other stakeholders to support development of policies that can improve access in a fair way. So we've done things like citizen deliberations and stakeholder deliberations that Rosalie will touch on. So with that said, around the overview of AgeWell and generally what our project is about, I'm going to hand over to Rosalie to go through the top 10 insights about our project. So Rosalie, over to you.
Excellent. Thank you, Mike. And it is an absolute pleasure to be here with you all today to talk about the work that we've been doing related to equity of access to assistive technology. So looking at the top 10 insights from our project so far, we've summarized them into 5 challenges and 5 solutions. And so you can see that with the arrows that are indicated in these 5 areas, that they're all very interconnected. And I'm going to review each one individually, but for the time being, I just wanted to emphasize that the project is very much an integrated knowledge translation project. And so as you can see from the arrows, there are a lot of interlinked components. And so there are dependencies and flow of information and the flow back of information to inform some of our different strategies. And so when we look at how we're integrating our knowledge gain and into our policy development work, we are very much also focused on including collaborators within this process. And so when we're engaging various policymakers, stakeholders who include people who are part of advocacy organizations, disability organizations, researchers, professional organizations, and organizations that provide care, and services to consumers or Canadians across Canada, we've very much tried to incorporate as much as possible the key players within the whole system. So for the next couple of slides, or next 3 slides, I'm going to sort of try and make some connections generally, so you have a sense of where the discussion is going to go. As I said, we've sorted them out into 5 challenges and 5 solutions, and in the next 3 slides, I'm going to sort of draw some more explicit connections between some of them, but again, the whole project itself is very much integrated. And so for the first one, we're going to look at the first challenge, which we started off with in our project, is we have a sense that equity of access to assistive technology is a priority issue, but it has actually not been systematically and comprehensively studied on a national scale at the time that we started this project. And so it's about 4 years ago. And so while there was a bit of work done in various areas looking at different jurisdictions or different types of assistive technologies, there hasn't really been a comprehensive study. And so that's what we set out to do. And within the first 2 solutions, we wanted to essentially develop and implement a transdisciplinary research initiative and be able to also convene a deliberative process with citizens to identify values and preferences, and also to work with stakeholders to identify the next steps for policy. So looking at the next 3 challenges, this is some of the information that we got from our initial information seeking process in solutions 5 and 7. And so what we did find is that there is complexities within the whole system, not that different to a lot of other health and social services offerings in Canada. And we did find some significant equity-related concerns and also areas of unmet need. And again, we also see one of the challenges to be that collaboration is really needed to be able to champion fundamental change and develop guiding principles and priorities. And with all of that information, we looked towards 2 other solutions, which are integrating our research findings, so collecting all of the information that we have, integrating that to help to develop a policy vision that can include principles to underpin policy action and policy priorities. And within that, the next step with that information is to be able to, again, convene policymakers and stakeholders to identify how to operationalize each of these priorities. So our final challenge that we've noted here is what we found across all of the information that we found so far, both from the literature and from our engagement in different ways with policymakers and stakeholders, is that there is really a lack of awareness and knowledge regarding assistive technology, its benefits, and where to find programs and for funding or services. And with that, we've tried to make a direct intervention related to that. So looking at creating a searchable web-based database to describe where the AT programs across Canada are and to be able to really address issues related to system navigation. And so that's the overview of our 5 challenges and our solutions, and I'll be giving a bit more detail around each of those. So we know that the first challenge really is equity of access is a priority issue, but it hasn't been systematically or comprehensively studied on a national scale. And so a lot of you have probably already seen a lot of these statistics. Our population is changing. The proportion of older adults is increasing, and it's anticipated that it will actually be doubling in the next 2 decades. And what that potentially means is that there would be more people in need of assistive technology, and that is for various reasons. The increase in number of people who have chronic conditions, and also there are age-related conditions that are more prevalent in the senior population. And we also do know from the Canadian Disability Survey that there is unmet need for assistive technology. And so for those who are between 45 and 74 years old, about 30% report experiencing an unmet need. And it goes up to 44% for people who have a greater severity of disability. The aging population can also result in as I mentioned, increase in chronic conditions. And also that does mean that we will need more support for caregivers, and assistive technology can be one of those areas that can be supportive. So our second insight was a challenge that we identified from the work that we've done to uncover some information about the landscape of assistive technology funding and service programs. So we completed a jurisdictional scan, which I'll talk a little bit more about later. But what we did find is that the system of access is very complex. So there are 222 funding and service programs between government offerings and charity organizations. And there are system navigation issues and access barriers. And so the example that we often give for programs that are fragmented, overlapping, and complex and uncoordinated is that there are 6 federal ministries or departments that provide funding for assistive technology and provide assistive technology funding and services, and that's in addition to between 2 to 7 separate provincial or territorial programs that offer assistive technology as well, and then charities that meet some of these different needs within all of that. And so what we do find is there are barriers to access because programs are challenging for consumers and healthcare providers to navigate. So this next slide just gives you a snapshot of the number of programs offered by government and charities that we found. And so we have quite a few programs that are offered nationally and quite a few within each of the different jurisdictions. And again, we found for government programs were 87 and charities were about 135, which is significant. The third challenge that we identified is looking at equity issues. And so there are individuals with unmet needs. So the programs themselves are highly variable across different provinces and territories, particularly with differences in eligibility criteria, devices and services, funding and service delivery mechanisms. And as a result, this means that there's inequitable access and disparities in coverage. And an example of this, we look at assistive device type that's being offered in Canada. And so if we just do a pure count of the number of programs for the different types of technologies that address different types of needs, we find that mobility is fairly well covered across many of the programs. And for communication and vision and hearing, there are quite a few programs as well, but not quite as many as for mobility concerns. And then when we look at things like cognition or psychological or mental health conditions, there are quite a fewer programs that provide assistive technology funding or service. And so that potentially does mean that there are a lot of technologies out there that could be benefiting people, but they're not actually provided for. And so that does result in some unmet need for people who have concerns with cognition and psychological or mental health conditions. So just looking at some of the findings that relate to insights 2 and 3, looking at equity and system navigation related issues from our citizen panels, which I'll also describe a little bit later in the solutions, is several challenges were identified by the citizens, and 5 of these actually relate to insight challenges 2 and 3. And so, for example, assistive technologies do not seem to be fairly allocated, which is the equity concern. Access is complicated and often not focused on the needs of the individual. And many people face challenges in paying for needed assistive technologies or engaging with the private sector to identify and purchase what they need. There's also a significant lack of an integrated approach to delivery of assistive technologies. And also caregivers report experiencing burdens and challenges in getting the appropriate supports that they need. And so that's another aspect of the information that we found related to the second and third challenges. The fourth one looks at the need for collaboration to be able to champion fundamental change. And so this challenge really is as you can see that there's quite a lot of collaboration that's needed in order to be able to address some of the values that are identified by citizens and some of the insights identified by the system leaders to support policy action. And so you can see that from our citizen panels, they identified the value of collaboration, equity, and accountability as key things to underpin policy action. And the system leaders identified the need for supporting informed decisions, getting the most out of public programs, enhancing access to assistive technologies that are not publicly covered. And so within all of these, we have a lot of information, but in order to actually spark fundamental change and to be able to develop some guiding principles and priorities, there's a significant amount of work that's required to bring people together, but to get a common understanding. One of the things that I will highlight here is that within our stakeholder dialogue, one of the things that we identified that really spurred our next steps was that the system leaders that we just deliberated with identified that a lot of the potential solutions are very incremental, but what is really, really important is from what they're understanding is that we do need some fundamental system change. And so the programs and the system, the way that it's set up right now, really isn't working for a lot of consumers and citizens. And so while incremental change is good, they gave us the impression that an overhaul of the system was needed. And we'll talk a little bit about that later. So the final challenge is looking at the lack of awareness and knowledge regarding the benefits of assistive technology and where to find programs for funding or services. And so I've highlighted a couple of points that are made by the policymakers and stakeholders in the stakeholder dialogue. And they did identify significant knowledge gaps around assistive technology. And so they were saying that we need to be able to spread awareness of assistive technologies and to be able to engage those who are using or in need of assistive technologies in crafting a long-term vision. And they also identified that capacity building among health professionals is also needed in order to be able to provide what is needed in an appropriate way. We've also interviewed stakeholders and policymakers related to the issue of equitable assistive technology access, and within these discussions as well, they identified that there was a universal lack of awareness, knowledge, and skills related to assistive technology and its access in Canada, and that education and training across the board would be beneficial. So going to our solutions, we're looking at our solution or Insight 6. At the start, when we had the initial idea that there wasn't a lot of comprehensive and systematic work on this topic before, we set out to develop and implement a transdisciplinary research initiative. And so part of that, we were looking at completing a jurisdictional scan, which essentially surveys all of the AT and funding service programs that are being offered by government and charity organizations in Canada. And this is a project that very much was a collaboration between us working with the EHL project and March of Dimes Canada. So we're extremely appreciative of the work that they've contributed to this project. And I've reported some of the findings from that already. We also embarked on a scoping review to be able to identify and map some of the literature on ethical challenges related to assistive technology access. And so that gives us a really good grounding on some of the concerns that we might be able to explore further in our project. And I've mentioned we did interviews with policymakers and stakeholders, and this is really informing some of our next steps as well. So I've previously also mentioned that one of our solutions was to be able to convene deliberative processes with citizens and also with stakeholders. And so I've also mentioned some of the findings from our citizen panels already and from the stakeholder dialogue. And so with the citizen panels, we were essentially looking at convening citizens to discuss how to enhance equitable access to assistive technology in order to be able to provide information to guide the efforts of policymakers, managers, and other professional leaders within the health system. So in our stakeholder dialogue, we convened policymakers, stakeholders, and researchers who are in positions to champion change, to be able to deliberate on considerations which include research evidence on how to enhance equitable access. And so you can see here some of the products that came out of the project, all available on the McMaster Health Forum website. And so I mentioned that after the stakeholder dialogue that there was the sense that even though there could be a lot of potential incremental change that might be able to help individuals or consumers, there was a sense that a fundamental change needed to happen to be able to sort of, in some ways, overhaul the system for it to actually better meet the needs of Canadians across Canada and their assistive technology needs. And so what we've done then is to integrate our research findings to develop a policy vision that includes principles to underpin policy action and policy priorities. And so this solution actually encompasses a lot of new steps that we've taken in order to advance this work. And so in order to be able to come up with a potential policy vision, which was identified by the stakeholders in the stakeholder dialogue, we embarked on consolidating a lot of the information that we found so far, and we've come up with a list of potential principles to underpin policy action and looking at short-term and long-term policy priorities. So we've completed another set of interviews asking stakeholders to essentially give us feedback on some of the principles and priorities that we've identified so far. And so the following step with that is to be able to finalize these principles and policy priorities and send it out in a survey that would be across Canada. And so gaining more feedback on how people are sort of ranking some of these principles, how important they see it to be for a policy vision. And so I'm not going to go over all of the specifics of the principles that were identified, but I'm just going to highlight a couple of these. And so what we found was that stakeholders identified that a rights-based perspective would be necessary to sort of underpin any actions in policy. Looking also to apply a social model of disability, very much including a person-centered and co-creation approach, and also being able to have a system that actually is supporting autonomy and informed decision-making, and also trying to ensure that that any individual in need of assistive technology can have access. And again, looking at collaboration and coordination among different players within the system, to also be able to use simple, flexible, and adaptable approaches for assistive technology access so that it is meeting needs of individuals who are all unique. We also need to potentially look at fostering innovation for new technologies or policy approaches, and also ensuring accountability to, for example, keep pricing of assistive technologies affordable. And so those are sort of some of the values that we've come up with from our collective work so far, which after a series of refinement of these, looking at the language and things like that, we will present these in a survey across Canada. Those are the values and principles, and we have also identified some short-term and long-term priorities. And so the short term, which would be from between 1 to 2 years, things that we can do to enhance fair access to assistive technologies. Some of these are adopting a common language. There's great diversity in the language for assistive technology and what it includes and what it doesn't include. The next one potentially could be to build awareness and knowledge of the benefits of assistive technology and the range of technologies available, some of the programs and services available to support access, looking at enhancing individualized assessments, ensuring that the needs of those who could benefit from technologies are reflected in these, be able to streamline the consumer experience, minimize coverage gaps and financial burden on consumers, building national leadership, and also fostering partnerships with industry. When we're looking at the long-term priorities, potentially 5 years and more, some of the priorities could be looking at government programs that help with technologies for basic independence, looking at programs that help with instrumental activities of daily living, and also look at making access more equitable for people who face the biggest challenges in access. So individuals who have disabilities, mental health challenges, homelessness, and other potential groups that don't necessarily have access as readily. We also want to potentially look at ensuring timely decisions about what technologies can enter the market and what technologies to provide funding for. And looking at ensuring that universally designed environments are consistently supported through public policy. Also, the final potential long-term priority is to improve the knowledge and skills of all professionals involved in the provision process. So again, these 3 lists are in the process right now of being refined before it is going out to a survey. And after consolidating some of that information or integrating that information, our next step is to be able to take our survey findings back to convene another meeting with policymakers and stakeholders to be able to identify how each of these priorities and principles can be operationalized within Canada in specific jurisdictions to be able to take some action. And so our plan is to be able to convene this meeting at HWEL's 5th annual conference in Moncton in October of this coming year. And some of our project partners include the APTA Hub in New Brunswick. They're a group that is specialized in policy innovation related to aging and technology. And of course, our project partners, March of Dimes Canada. And we've also engaged the Canadian Assistive Devices Association, which is the industry group in Canada. Okay. And finally, one of our solutions to directly address the information gaps related to assistive technologies and system navigation is we are taking our findings from the jurisdictional scan that outlines all of the programs that provide funding and services for assistive technology in Canada and creating a searchable database. And so this is just one of the projects that we've taken that directly address some of the issues that we've found within the system. And really it's being able to provide information when people are needing it in an accessible way. And so our web-based database will be able to have some functions where you can search by location, where you are, the types of technologies that you might be looking for, or some other smart search mechanisms in order to guide individuals to find the information that they need about funding and service programs. So that concludes the content related to our project specifically. So I'll pass it on to Trisha.
Hi, everybody. I'm sorry I had some technical difficulties, so I'm joining a little bit late, but I'm very excited to be here today. I'm going to briefly touch on the 5 challenges from the lens of service provider and what we see on the ground in terms of March of Dimes Canada's Assistive Devices Program and the Assistive Mobile Technology Initiative. In terms of equity of AT access, from a service delivery perspective, primarily from an Ontario lens, we see the difference between what the Ministry of Health would cover in terms of funding supports and what we, March of Dimes Canada, would cover that would be similar, and what neither of us would consider fundable AT. Examples of that would be repairs to existing devices, Hoyer lifts, AT for community access. Those are things that March of Dimes Canada would fund, but the Ministry of Health would not fund. In jurisdictional programs like ODSP, we consistently see one ODSP office in one catchment area approve a device for funding, and in another catchment area, they would say that that same device is not eligible for funding. We see, based on definition of disability, that there is an inequality in equipment options. Marchedimes Canada offers service based on disability general category, and others are disability specific and only offer funding or equipment options to those who fit their definition. It's common for us to see requests for assistance for the remaining client portion on a power wheelchair after the ministry approves their 75% portion. Consumer A, as an example, would apply to Marchedimes Canada for $3,000, and they have muscular dystrophy as a disability. We would assist them in approaching Muscular Dystrophy Canada, and they, Muscular Dystrophy, would agree to cover $2,440. That's their maximum amount of funding, leaving the consumer and Marchedimes to work to gather $560. We do that and the consumer gets their chair. Consumer B applies to us again for $3,000, but they're a senior who's recently had a stroke. There are no other funding supports available to this consumer, and if we aren't able to, and they aren't able to pay the remaining client portion, they don't get their device. This is not universal access. This is a system siloed and segmented in terms of some of the haves and have-nots based on what disability you have and how resourced that focus area is. This segues nicely into Insight 2, and AT access is complex, and the system navigation issues and access to barriers. We know from our on-the-ground work here in the Assistive Devices Program that there is a piecemeal approach to service delivery. It is not linear. It causes great frustration and upset from the consumer perspective. Regardless of whether you're new to disability or you have been disabled for many years, the system is so complex. And as mentioned earlier in the presentation, there's differences to eligibility criteria, application processes, wait times. These are challenges enough just for myself and my team to keep track and understand. And we do this on a day-to-day basis for a living. Imagine how you would feel just coming out of the hospital and trying to find your way with no supports. Not everybody has a support team, support staff, or family helping them. Many people go on the journey of trying to acquire AT alone. And this is the uniqueness of Marchedimes Canada's Assistive Devices Program. We know and understand this, and we provide navigation support. We assist our consumers in locating additional funds. We will reach out to their local service providers, government sources, and other funders, and start the conversation to coordinate the purchase and delivery of that needed AT. In terms of equity issues across Canada and that unmet need, again, primarily right now we're in Ontario, but we are in expansion mode, and we know that access to AT is not the same in all provinces. We will expand service delivery from the highest level of need to the lowest, because that speaks to the inequality issues across Canada. Our expansion approaches are based on demographic and statistical information on disability, poverty, the LICO levels, and the service and funding that's available. In terms of collaboration and the needed champion and to help drive change and the guiding principles and priorities, a strength of Marchedimes Canada as a service delivery organization is that we understand the gaps in the current system, and people are falling through those cracks from a system navigation perspective. We can then work with researchers such as Mike and Rosalie to validate that we are experiencing, through evidence-based research and better understanding, the issues from an unbiased and systematic perspective. Using our knowledge and experience on the ground and evidence provided by research, we can then work to begin to develop an advocacy plan and issues to facilitate system change at a policy level. While policy change can take a significant amount of time, it is critical to consider how we can improve our existing systems to ensure people are receiving the supports and services they need from a system perspective. Sometimes advocacy priorities align with government goals, and other times they don't. And we work to ensure our advocacy efforts bring about actionable change. Lastly, and thoughts in regards towards the lack of awareness and knowledge regarding AT. March and Dimes Canada started the Assistive Mobile Technology Initiative in 2015. It's a contest where we give tablets away in 6 provinces across Canada. But we did that because it's not a constant offering in our product list. And this type of technology has, up until recently, we believe, been seen as a primary need, has not been seen, as a primary need for people, and rather an auxiliary need. And through AMTI, we have been able to see firsthand how a tablet can be just as valuable to somebody with a disability as a wheelchair could be. We have come to feel that there was almost a lack of recognition for the use of technology, as well as perhaps a little bias. People can have a hard time looking past the fact that people with a disability, and even extreme disability, can meaningfully use a tablet or a phone. That level of judgment perhaps maybe comes from someone who uses said device to primarily communicate socially, and they have no experience using that type of device to turn on and off their lights, notify their support staff, open and close a door, book transportation, and use that device in replace of their actual voice. Technology can be seen as an extravagance and not mandatory, like a wheelchair would be for someone who could not walk independently. We know, and we've seen over the past 4 years, that a tablet can provide independence, it can provide increased mental health, it can provide opportunities to education and employment, it reduces social isolation, and it promotes community integration. Before I wrap up my portion, I'm watching the time here. I just wanted to share a small snippet of a story from one of our AMTI winners that really documents from this perspective what that type of technology does for somebody. And Colin was one of our winners, and the effects of Colin's disability leave him with hearing loss and significant visual impairments. So just to add some context to it, and this is a quote from Colin's support staff, and I'll just get to read it word for word because it was an email that she had sent to us. Colin has literally called me every day since he received it, including leaving messages on the weekend, all about the ways he's going to use the device. I know you might not believe this, but honestly, Colin's demeanor has improved since learning of his selection. I believe he feels isolated much of the time and felt somewhat abandoned by healthcare providers and community agencies. Because he has difficulty hearing on the telephone, he can present as frustrated and demanding. He's really a lovely fellow. However, with his communication issues, he often feels unheard. Since hearing he would receive the iPad, all his messages are calmer, and he ends any conversation or message he leaves with wishes for a good weekend, evening, or a happy Easter. This is definitely a change. He cannot wait to be able to send me emails. Please do not underestimate the impact the AMTI contests have on the well-being of an individual. It has been such a positive impact on Colin's life. Thank you, everyone. I appreciate your time and attention today.
Thanks, Trisha. Those are some very interesting insights, and particularly around the use of technology as an assistive device, because I think for some people anyways, that might not be the traditional idea of what assistive technology could include, but I think your points around how they can affect social isolation and communication, but also, enabling different activities, as you say, turning on and off the lights and, booking transportation and stuff is also quite quite compelling too. I would encourage anybody who has questions for Mike, Rosalie, or Trisha to use the chat box on the right-hand side of the screen to ask any questions. Just while we're waiting to see if any questions do come through, Mike or Rosalie, do you have anything that you'd like to comment on or any questions that came up from Trisha's comments?
Nothing specifically for me, Steve, other than just thanks for the very helpful reflections, Trisha. I think it's always helpful to hear from those who are actively engaging in the programs and trying to get people access to what they need and the types of challenges that are faced. And it really helps the work of Rosalie and I and others to keep grounded in that kind of stuff. So, Rosalie, anything from you?
Yeah, so I want to. Trisha, thank you so much for commenting on the challenges that we've uncovered so far and for the story that you've brought regarding Colin. Access to information and communication technologies is one of the big areas that we see because it's so important for people to be able to communicate. And now that we do have all of this information and communication technology that is pervasive and a lot of people have them, it seems like there's a great imperative to be able to essentially make the most use of those kinds of technologies out there for people who do experience communication challenges or other kinds of challenges. One of the things that I guess, Trisha, a question for you would be if we are to be able to promote potentially filling in the gaps around what is being provided by government programs, would you see that information and communication technologies would be one of those areas?
Yes, absolutely. It's one of the like, I don't want to repeat myself, but it is something that is just as beneficial to somebody that needs a mobility device or needs a piece of equipment to use the washroom with. So certainly, I hope it's something that they will start to look at and fund that new type of technology.
And I think some of the responses that we've had from some of our policymaker and stakeholder interviews really look at several points related to these kinds of technologies is that potentially can decrease the stigma of using technology. It doesn't, because so many people have them and use them, it doesn't necessarily shout out to people that they're using it because of some form of a disability. It's because everybody else is using them and it's very useful and multi-purpose and multifunctional. So I think that that's something that's really a benefit. So thank you so much for, I think the program that March of Dimes has initiated, I think will generate some really beyond individually helping those who are receiving them, but I think it'll offer a lot of insight in terms of how people are using it and what the benefits will be. So thank you so much.
Thank you, guys.
I just have I have a question, and I know a lot of the research that you've done, and certainly Trisha, the work you do is focused on Canada. But do you have a sense as to the challenges faced in Canada in terms of accessing assistive technology? Is that something that is comparable around the world, or are there sort of unique challenges to Canada?
Maybe I can address that. It is definitely a big topic right now internationally, and for many different reasons. We see with the World Health Organization, there's a lot of work that's being done with their GATE initiative, looking at enhancing equitable or enhancing access to assistive technologies in general. And obviously with different regions and countries, the issues might be slightly different, but access is a big topic right now, particularly when we look at addressing the UN CRPD, lots of different areas around accessibility and access to communication technologies to make people's needs known, for example, is a big area. And other aspects of the UNCRPD look at assistive technologies as one way of being able to equalize opportunities for people who have disabilities, and enhancing the potential for education, employment, and ensuring that people are able to be full citizens in their communities. So that is a big area right now. And also I think the Sustainable Development Goals that were just released also point to assistive technologies as potentials for being able to help address some of the Sustainable Development Goals. We also know that there's a new document internationally that is Rehab 2020, where not necessarily just looking at addressing medical needs, the rise in importance and significance of rehabilitation is also pointing towards we need to really make sure that access to assistive technologies is available.
Great. Thanks a lot, Rosalie. I don't think we have any other questions, so we'll just maybe wrap up the webinar, but I'd like to give big thanks to Trisha, Rosalie, and Mike for joining us today and for sharing your insights on a really important topic. We will be posting a recording from this webinar on our site in the next week or so, so please feel free to watch it there or share it with other people that you think might be interested in this topic. And we hope that you'll join us for future webinars. Thanks everybody for joining us today.
Thank you.
Thanks. Bye.